So all of those things, it's such a key entrance into the rest of the body that we have to be paying attention to what's going on in our mouth and what we're putting in our mouth, whether that's food or drink or medications or toothpaste or different products. We have to be paying attention to it because it is direct access into all of these systems in our body.
Welcome to Suburban Warrior, the podcast that will impact, inspire, and empower you to transform your mindset and become the badass warrior that you are. I'm your host and fellow warrior, Chrissy Pfeiffer, former clinician and corporate marketing exec turned multi-passionate entrepreneur, performance and life coach, and mom to 4 not-so-little warriors. Each week, I will bring you honest conversations with inspiring guests to share their stories of resilience, optimism, success, and simple yet effective strategies so that you transform your thoughts and change your behavior to get the results you want in your life. You will be empowered to take action, warrior up, and believe in you. Let's do this. What's up, warriors? Welcome back to another episode of the Suburban Warrior Podcast. I'm your host, Chrissy Pfeiffer, and I am back this week with another amazing Suburban Warrior here to share her story and expertise with us. And before we get into my amazing guest today, I just want to shout out a reminder to all of you that if you go to suburbanwarriorpodcast.com, we have the free From Pause to Power roadmap. This is your everything guide to everything perimenopause and menopause. It is really exactly what I wish I had 10 years ago when I started going through perimenopause and, was going to doctor and getting no answers. This is your guide to really help you through this transition of life. It's questions to ask your doctor, tests to ask for. Whatever you need, you name it, it's in there. So go download your free From Pause to Power roadmap today. And while you're there, be sure to sign up for our Pause Like a Warrior newsletter. Each week, we will drop into your email a newsletter with all of the latest podcast episodes, as well as some important health information that is going on for women that week. So be sure to sign up for that as well. So now let's get into my guest this week, which I'm really excited about this episode, guys, because I know we talk a lot about gut health on this podcast. We talk a lot about how gut health contributes to our overall health. And, we're starting to learn more and more that gut health also includes our oral health and our oral hygiene. And that includes our teeth and dentistry and how we take care of our teeth. And so I am really excited to introduce my guest today because we are going to really dive deep into this topic about oral health. So let me introduce to you Dr. Toni Engram. She is a biological dentist, integrative health coach, and owner of Flourish Dental Boutique in Richardson, Texas. After her own personal health struggles with an autoimmune disease, Dr. Engram shifted her practice philosophy to focus on whole body health and the prevention and safer treatment of oral disease. She has degrees from Texas Christian University, I was just about to say TCU because that's what everybody knows it as, and Baylor College of Dentistry. Dr. Engram is a member of the International Academy of Oral Medicine and Toxicology and the International Academy for Biological Dentistry and Medicine. She is a SMART certified and safe amalgam removal technique accredited through the IAOMT and is a TBI ambassador through the Breathe Institute. She's also a certified integrative health coach through the Institute of Integrative Nutrition, as am I. Yay! So I'm so excited to have you on the podcast today, Dr. Toni. Welcome.
Thank you so much. I'm so excited to be here and always excited to talk to another IIN grad.
I know. Me too. I knew it when I read that in your bio. I was like, yes. I'm like,
yay!
I love it. Okay, so tell us a little bit more about yourself and sort of how you got into this, not only just dentistry, but this really holistic view of oral health and dentistry.
Yeah, well, my road into dentistry is a boring one. Like it was the choice, it was like process of elimination. I wanted to be in healthcare, but I didn't want, like I was okay with 8 years of school, but then another 4 years of residency, like
Yeah.
internship and all that stuff. I just wanted to start my life at 26, 27. I thought that was reasonable. So
Sure.
that's what
Yeah.
led me into dentistry. And if that tells you anything, like I just wanted a normal career. I just wanted a normal
Yeah.
job at a normal dental office and just normalcy, peace, quiet, all those things. But thankfully, that is not what God had planned for me.
It never is it?
No,
No.
no. So going through dental school, I had symptoms. I had like some gut issues here and there. Was able to power through, ignore them. Had a really rough first pregnancy where I was having other symptoms, all related. I just didn't put the pieces together. Everything kind of fell apart, and I got super sick when I opened my first practice. So I was working full time. I had a toddler at home. I was starting this practice from scratch, on top of working full time. I was really just doing like I'd always done, being a type A, good student kind of girl.
Yeah.
And man, I got so sick, so many gut issues that I was having to call in sick more often. I just really was not feeling good. And it took months to get a diagnosis. Like so many people, I would go from doctor to doctor. They would just tell me it was IBS, here, take some peppermint oil, those kinds of things. So it wasn't until I was going to the bathroom like 20 times a day.
Oh my
It was bad. So finally, when I started losing weight and having blood in my stool, I was able to get a gastroenterologist to kind of roll his eyes and say, all right, let's do a colonoscopy and look under the hood and see what's going on. And so that's when I was diagnosed with Crohn's colitis and had some pretty significant damage to my colon already. And I was given very much the typical Western medicine answer was, here's your medications that you're going to take. You're going to take them until they stop working. And then we'll put you on stronger meds. And then, oh yeah, by the way, at some point, you're probably going to need surgery to lose all or part of your colon. And this is when I was 30 years old. I had one child.
So young.
I was starting a business from scratch. Like that was not an okay answer to me. And so I asked him, I was like, well, what do I need to do to just get rid of this? What do I need to do to actually be healthy again? How do I need to eat? And the answer, again, bless his heart, as we say in the South, was very standard Western medicine answer. It was, there's really not much you can do. Your diet has nothing to do with this. Like, look me in the face and told me the holes in my gut have nothing to do with my diet. So thankfully.
And this is coming from a gastroenterologist.
From a gastroenterologist.
Right, who deals with the digestive system and where do we process food in our digestive system. So crazy, just crazy.
Bless his heart. Yes.
Yeah.
But I'm so thankful, really so thankful for the experience because I was stubborn and I didn't buy that answer. I was like, that just doesn't sit right. It doesn't feel right to me. And so I dove in. I didn't know who to ask or who to talk to. So I just got on the interwebs and did my own research and started figuring out all these things that helped me feel better. But what was interesting is that along the way, the more I learned, the more I was like, Crohn's disease. It's an autoimmune condition, but really at the base of it all, it's an inflammatory condition caused by a dysbiosis in my gut. And then, oh, holy snap, what do I treat every day in my office? I treat tooth decay and gum disease, inflammatory conditions caused by a dysbiosis in the very first part of your gut. Yeah. And I was not helping people in that phase of my career. I was doing the standard drill, fill, and bill model where we can restore the function and the structure of somebody's teeth, But a lot of times we're not getting to the root cause, so we're really not helping. And then they just come back 6 months, a year later with the same issues, just a different spot, a different tooth. So I really felt like, okay, if I can figure out how to get well myself, and I did, then I have to be able to figure out how to do this for my patients too. So that's when I really started. As I was feeling better, I had the bandwidth to be able to do the research for my own career now. So I really started digging into the oral systemic connections. My patients nudged me the rest of the way. The more I started talking about nutrition and prevention, the more my patients would say, that's really interesting, Dr. Toni, but why are you still using fluoride? And what are you doing with these mercury fillings that you're drilling out? Like, they really nudged me in the kindest, most gracious way to do better for them. And so thankfully, I got to go through all of that so that I could get to do what I do today, which is find the root cause. Yes, we still need to restore function and structure to the teeth. We still need to do quote unquote normal dentistry. But if we can get to the root cause, we can help people have a whole lot less of it.
Yeah. Okay. So fascinating story, and terrible that you had to go through, that whole journey, on your own and for yourself. But I do think it is obviously always the message is in the mess. And that is sort of how you ended up getting to where you are today and doing this and all the things that you've learned. So talk to us a little bit about our mouths in general, because I don't think that we think about our mouth as the beginning of our digestive system or the beginning of our gut, right? We think about it as sort of it's just separate. It's our mouth. It's our tongues, our teeth, our mouth. So we don't really think about, I think, our digestive system starting until where you can't see, right? Maybe your throat, maybe your esophagus. But, it makes complete sense. Like all the mucosa, it's all, you're starting the digestive process. Like we were built as human beings to sort of, chew our food and start to break down food in our mouths. So talk to us a little bit about our mouths and sort of, why it is the beginning of our digestive system.
Yeah, and why it's so unique and special.
Yes.
It is, just like you said, it is covered in all of this mucosa that it's highly absorbent. So it's a really close entrance to even our circulatory system. But as far as our digestion goes, all of our saliva has all of these beautiful salivary enzymes. So we start breaking down our food. We start the digestion process as we're chewing and releasing these salivary digestive enzymes. The more we chew, the more of those we release, and the better our food gets absorbed as it goes down further in different stages of the gut. It really needs to start in the mouth. So not only is it the first part of our digestion, it's a really close link to our circulatory system. And it's also our backup entrance into our respiratory system. So all of those things, it's such a key entrance into the rest of the body that we have to be paying attention to what's going on in our mouth and what we're putting in our mouth, whether that's food or drink or medications or toothpaste or different products. We have to be paying attention to it because it is direct access into all of these systems in our body.
Yeah. Yeah. I mean, there's a lot of, whether it's a supplement or a drug or a vitamin. In pharma, I used to work on a drug that was absorbed through the buccal mucosa because, there is such a high rate of absorption in our mouths. And so to your point, it is a highway directly into our circulatory system. And I think a lot of people don't think about it that way. So tell me a little bit about why what you do, biological dentistry, is different from sort of the traditional, as you said, drill, fill, and bill model.
Yeah, different from what I used to do for sure.
Yeah.
So biological dentistry and the terms, I hate that there are so many terms. I mean, I get it because we all have our little niche that we fit in, but holistic, biological, functional,
Yeah.
integrative. Like
Yeah. Yeah.
it all is pretty much,
Interchangeable.
we've got the same philosophies. But when we talk about biological dentistry specifically, that term specifically, it goes back to the principles of biological medicine, which instead of just looking at the germ theory of disease, where one bug causes one illness and therefore one drug can knock out that one bug,
Okay.
it goes beyond that to the terrain theory of disease, where what is the health of the entire system? What's the health of the terrain? And what are we doing to either support the health of the entire body or to not support the health of the entire body? It's, we hear a lot of people talk about what's your toxic load, how full is your toxic bucket? That is the essence of biological dentistry. It's how full or have we made that toxic bucket, and what are we doing to help empty that out in a safe way and not add more to it? We really
Yeah.
want to first do no harm, and
Right.
that is sometimes tricky in dentistry because we're using man-made things in your mouth and trying to do more good than harm. Well,
Right.
now we're realizing that some of those things aren't quite as safe as we thought they were in the beginning.
Yeah, yeah, absolutely. So let's talk about that a little bit more. What are some things that we are doing, not just even at the dentist, because I'd love to know some of those things that you're finding out that, things that we thought were safe. Like, I mean, back in the day, we thought the mercury fillings were safe. So I'm pretty sure everyone knows that they're not safe anymore. However, what are some things that we're learning about from a dentistry standpoint that aren't safe? But also, I also want to know, like, what are we doing on a daily basis that is not safe? Is mouthwash safe? Is toothpaste safe? And, again, and then I'm going to say this again, fluoride. Like, the story about fluoride. I mean, when my kids were babies, I was told to put fluoride in their water because they weren't getting enough. Now I'm like, when they go to the dentist, I'm like, no, they don't need fluoride.
Mm-hmm.
I don't know what to do. So
I think
first tell us,
right?
oh yeah, I'm like, is it safe? Is it not? I don't think we need it. I think, so I want to talk about fluoride too. So first tell me a little bit about the dentistry stuff in general. Like, what are you learning that maybe is not safe that we thought was?
Well, I'm sure your audience is probably along the same wavelength, but believe it or not, there are still many of my colleagues who have no problem with the old silver amalgam fillings at all, even though they're
Oh,
half mercury.
I
And
totally thought that was a thing in the past. I had no idea people were still using them.
people still use it. Not as many, but people still use it.
Wow.
And even if they're not using it, we still have to drill that stuff out of people's mouths every day and have these huge exposures of mercury. And a lot of my colleagues just don't think that that's a problem. And so they'll drill these suckers out. They'll replace them with porcelain or composite or whatever the case is. But because they don't think that it's a problem, they will drill it out without any kind of protections or coverage whatsoever and just create this plume of mercury vapor in the whole room and office, which I think
Yeah.
is less than ideal.
Okay.
So yes, unfortunately, we haven't completely put the mercury issue to bed yet.
Okay.
It's getting there.
Interesting.
Finally, the
Getting there.
FDA finally says, it's probably not great to place these in pregnant women and infants and children. So,
Which means it's probably not safe. Why place
probably
them
not
anywhere?
safe. Yeah.
Yeah.
So baby steps, baby steps.
Yeah.
Another big one is, we're realizing that all of these different materials and different metals that we're using can create kind of a battery effect in the mouth. They'll
Okay.
have this galvanic response in the mouth. And so wherever possible, we try to avoid metals, or at the very least try to avoid a bunch of different types of materials in the mouth, because when you've got metals where typically you would have this normal human galvanic response, it really can create some issues, and patients can have some sensitivity, some pain just from the materials that are being used.
Okay.
Toxins, obviously, mercury, I think fluoride is another big one. Fluoride in the water, I think, is really where we all need to plant our flag and say no more.
Yeah.
Fluoride in our water is medicating the public without their consent.
Yeah.
And when I was in school, I don't know about you, I'm guessing when you were in school, that they said medication without consent was kind of a no-no.
Yeah.
And that's exactly what water fluoridation is. So I'm
And so
really,
just to be clear for our listeners, because I know what you're talking about, but you're talking about like because the government puts fluoride in our drinking water. And that is something that has been going on for a very long time.
Mhm.
And many people don't realize that. I just wanted to clarify that that's what you're talking about.
Yes,
Yeah.
yes. The municipal
Yes.
addition of fluoride
Yeah.
in our drinking water. Sometimes it is naturally occurring from runoff, but that's accounted for.
Right.
Even that needs to be measured. And the issue is that when it's in the water supply, it's everywhere. It's not just
Yeah.
when you drink a glass of water, it's in
Right.
everything you cook with. Even if you grow your own food in your own garden, if you're watering your garden with your water hose, then it's still, even your own homegrown vegetables are getting fluoride in them.
Right.
So it's really hard to avoid when it's in the water. And I'm really hopeful that we'll see an end to that within the next few years. It
Yeah.
looks like it's heading that direction. So I'm really hopeful for that.
And what is the downside to having too much fluoride? Because for years and years we've been told, like I said, like when my kid and I had babies, the pediatrician was writing me a script for fluoride drops to put in their water. Now I will say I definitely forgot most of the time to do it, so they weren't getting it. But they were, I was told, oh, in order to have strong teeth, you have to put these fluoride drops in their drinking water, specifically like a vitamin, and then it turned into then twice a year when they're going to the dentist painting their teeth with fluoride and mine as
Mhm.
well. And it wasn't until a couple years ago, that I realized that this was toxic and we shouldn't be doing this. And we stopped. But what is the harm that fluoride is causing?
The main issue right now, and what the research is kind of honing in on. So I think there are, I think fluoride competes in the thyroid for
Yeah.
iodine, so it's not good for thyroid health. There's some evidence that it can calcify certain structures like your pineal gland. But really, the big one, the one that has been so eye-opening for me over the last few years, is all of the recent research around our kids and their brain health.
Yeah.
So I don't know if you've heard too much, or if your audience has heard too much about the lawsuit with the EPA recently. It's been a struggle for years, but there was a nonprofit group that sued the EPA over water fluoridation, and the reports were suppressed for a good amount of time, but were finally released. So there's what's called the National Toxicology Program. They did a study, this huge meta-analysis of like a study of studies around water fluoridation and our kids' brain health. And what they found is that they really could not determine a safe level of fluoride in our water. They couldn't. They couldn't find one. And they noted in multiple studies, they were noticing that higher levels of fluoride, either in mom's urine or in the water, were correlated to lower IQs in our children. And if you're in an area, or if you have a kid who is struggling, who has educational struggles, who has learning disabilities, any kind of learning challenges, if you've got a toxic substance that takes them down just a half a notch, that's a half a notch too much.
Yeah.
Like we don't need our
Absolutely.
kids to be fighting just to get at baseline for their health. So the research that's coming out on that is more and more concerning to me. And that, combined with the fact that it's just an okay tool at fighting tooth
Yeah.
decay. So in my
Right.
opinion, Like, what the heck are we doing
Yeah.
if decay is still rampant in this country? Like, we still don't have a handle on it. It's still the number one cause of missed school. It's one of the most prevalent childhood diseases. What's fluoride been doing for us? Not much.
Right.
So I think the risk is just, it's too high to be in our water. And because it's still everywhere, I just don't use it in my practice at all anymore.
Yeah. Yeah, and I think, you brought up the point about medicating without consent. I mean, that's a real thing because I think most people don't realize that, that the water is treated with fluoride and, that's really a problem.
And you can't control the dose. Like, how do you?
Yes, right. You have no idea. And for those that drink a lot of water, like someone like me, like if you're not drinking from a filtered system, and then again, how much is even being filtered out? It's really scary knowing,
Yeah.
that all those things are in your water.
Okay.
Okay, the next thing I want to talk about, because I've also heard some rattling around about this, but I don't know the full story and I would really love to know. What is the deal with root canals? Because as far as a root canal, normally you just hear, if you go to the dentist and your tooth is falling apart or it's coming out, or then you got to go get a root canal before you can get the crown. And it seems like standard practice, right?
Yeah.
Like this is just what happens as you get older. Your teeth are falling out. This is what we do. But I've seen so much talk recently about how root canals can really be harmful to you as a whole. So tell us a little bit more about that.
I love this question because it's so controversial, but it's also so nuanced.
Yeah.
So, to understand, for one, I'm not dogmatic on either side.
Okay.
The problem with root canals is when you perform a root canal, what you're doing is you're removing the nerve of the tooth to help with pain and to help prevent infection, active infection around the tooth.
Okay.
But you have to understand that that's taking one tiny little tube down the middle of the tooth, where really the tooth is more like a sponge. And you've got all of this spongy structure where there are teeny tiny little microscopic little canals and blood vessels and all of these things. So we can do an amazing job at doing a root canal. It can look great to the dentist on an x-ray, but that's not the whole story. We can't guarantee that we've cleaned out the entire tubular structure within the sponge that is our tooth. And that's where the potential problems can lie. Again, going back to the terrain theory, are we filling someone's toxic bucket? So a lot of people can have root canals and do just fine. They have no symptoms at all. But your immune system is having to work to maintain that tooth. The bacteria in the area will shift. And so you'll get from these aerobic bacteria that have oxygen available to them where there's blood flow in the area. That starts to shift to more of these anaerobic bacteria because the tooth no longer has a blood supply.
Yeah.
And that your immune system is constantly having to work on. And so for some people, that can be damaging to their health. And some would argue that it's damaging to everybody's health. But we're talking about just where you would see evidence elsewhere in the body.
Yeah.
And that's where, as a dentist, I have to be careful what I say. I want to stay in my lane. I can't say from the evidence that a root canal is going to cause X, Y, and Z health issue. But I do see some really interesting conveniences because sometimes we're filling these toxic buckets just a little too high for some people. And so some people will notice that they had a root canal, and if they get like a breast tumor or something like that, or have some kind of other chronic health issue, maybe it's along the same side of the tooth, and maybe it shows up a couple of years later. Could be complete coincidence, but also we see where some people will have a root canal removed, like they'll just take the entire tooth out. and they'll notice that some of their chronic health symptoms will disappear or get better.
Wow. Yeah, because I guess maybe it's triggering an autoimmune response, right? So,
Exactly.
yeah, you're
Exactly.
just simply getting a root canal is triggering your body to jump into this immune response, which is that is what our body does naturally, right? And it's meant to go to the site, reduce or it cause an inflammatory response acutely. But what's happening is then it's causing an inflammatory response chronically because it's not going away. And
Right.
so your body, again, and maybe everyone's response is different, right? Because we're all different. But it can, for some people, it can really cause something really harmful wherever it is. Or maybe some people are completely fine. Then again, the question is that something you want to gamble on?
Right.
Right?
Yeah.
And now, when you say you remove the root canal, how do you do that?
That you remove the entire tooth.
Okay, so you remove the entire tooth.
Yeah. And
Gotcha.
that's not always, that's where it gets really nuanced. And we've got to have these discussions individually with a patient because it might be that it's a tooth in the back that you never see and you never quite use. And so if you've got a choice between doing a root canal or removing the tooth, you may be like, screw it, remove the tooth.
Yeah.
Or it may be that you had an accident, you had a fall, and you broke a front tooth, and you could save it with a root canal or not. And holy smokes, you're a 25-year-old woman and about to get married. And then it becomes a much different question that we have to have
Yeah, sure.
holistically speaking.
Right, right. Okay, so then what about like crowns and things like that? Are those harmful? Does your
It
body sort of go into the same type of autoimmune or, inflammatory immune response
Not
since it's like a foreign
necessarily.
object? Okay.
So we have to be careful with the materials because some
Yeah.
people will have reactions to the materials, and we try to source those. We try to make sure that we're using the ceramics and things that are way more biocompatible.
Okay.
Also, the placement itself can determine whether there's going to be a mild reaction in the area or not, but most of the time they do just fine. Now, obviously, we
Okay.
would prefer not to need them because it is more invasive than doing a filling. But sometimes, in some cases, that's the better option because it preserves your natural tooth for longer, even though it's a more invasive procedure.
Okay. So when you're looking at materials that, dentists work with, ceramics would be the top, do no harm kind of material. Yeah.
Yes.
Okay.
Yeah.
All right. Good to know.
Either
Good
like
to know.
a pure porcelain or a zirconia.
Okay. So then what should we be doing for our oral health and our oral hygiene? Like what is the process that we should be doing? Because now I feel like everything just goes out the window. Should we be brushing twice a day? Should we be flossing, tongue scraping? Let's talk about it. What is in your mind is ideal oral hygiene?
Well, I think for some people it depends. Like we
Okay.
want to take everybody's skill level into mind. You're not going to hear me tell an 80-year-old former football player with big, huge meat hook hands that he's got to floss every day. I'm just not going to do it. Maybe my hygienist will, but I'm not going to hear it come out of my mouth. So in a perfect world, I would love to see everybody use a high quality electric toothbrush. And
Okay.
I would love to see everybody floss with string floss instead of the stuff on a handle.
Okay. Why is that?
It adapts to the tooth a little bit better. Like you can get
Okay.
it again, if the skill level's not there, if you're not going to be able to, then I'd rather you use a flosser than nothing.
Right.
But the string can adapt to all around the tooth better.
Love it. Okay, good to
Yeah.
know. Did not realize that, but actually now that you say that,
Yes.
it makes sense because it's
Yeah.
longer. Yeah,
Yes.
yeah. Okay.
Yes. And I think tongue scraping is really important. And that's about it. Like
Okay.
I use mouthwash pretty selectively. It depends on
Yeah.
the needs of the patient and what we're trying to achieve and how long of a period we're going to go. I don't love the how I used to do it was just use Listerine all day
Yes.
every day because I was addicted to it.
Right. I have seen again, and this is something, along with my research, that mouthwash can do sometimes more harm than good because it's
Mhm.
disrupting your pH, it's killing some of the bad bacteria that you need, not just, I'm sorry, killing some of the good bacteria that you need,
Mhm.
along with the bad, and sometimes it's just not necessary. We've been told that we should be using mouthwash, like you said, all day, every day, but it's really not totally something that is necessary.
No, it's like the equivalent of taking Roundup to your mouth, where
Oh,
you
God,
really
that's
want to
awful.
you really
When you
want
put it that
to,
way, I don't think anybody should ever be using
right?
mouthwash ever. Yeah.
Right,
Oh,
but it is.
God.
You're just taking alcohol and you're just beating down the
Oh,
microbiome, good and
yeah.
bad, without being selective.
Yeah.
And for some people, sometimes, now I like to test my patient's saliva and see which bacteria are in there. Sometimes it might be useful to do that for a short period of time if we've got some really stubborn bacteria that we need to knock out of there. Like there are a couple of strains like Porphyromonas gingivalis and a few others that are implicated in pregnancy issues, fertility issue, Alzheimer's, dementia. Like if you've got some of those bad bugs, I want to knock that crap out. And
Yeah.
so I don't use Listerine anymore. I think there are better ones, but I might use something like a Closis or something that has an antimicrobial in it, and I'll use it for 2 weeks.
Okay.
Two
And the
weeks.
ones that you like, are they over the counter or are they ones that are they prescribed? Like if you don't like
Both.
Listerine, okay. Like
Yeah.
what is your favorite one that you can get at the CVS or whatever drugstore?
Closest is for
Oh,
sure
closest.
my
Okay.
favorite over the counter one. Yeah,
Okay.
Closys, and it's a really boring bottle, usually on the bottom
Oh
shelf
yeah,
because
I've
their
seen it.
packaging's not very pretty. So,
Of course. Of course it's on the bottom shelf because it's the best.
right,
Yeah.
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 So I think that is a really effective and not super expensive antimicrobial rinse that I think is good for a certain period of time. You
Okay.
can also, if you're in the health food store, something with tea tree oil can be
Okay.
really effective, or something with peroxide. Peroxide is great. Depending on the
Okay.
bacterial strains, some of them respond really well to exposing them to oxygen. So that
Okay.
can be really helpful. And then once we've gone through that 2 week cleanse, so to speak, the knockdown of the microbiome, then we can reseed with some of the good bugs that we want to add back in there. And so I have some oral probiotics, different than the kinds that you swallow, but some oral probiotic tablets that can help repopulate with some of those more beneficial strains.
Okay. And then, so by doing that, then how does our oral health, like, does it, like you said, it's affecting our overall health. It's not just affecting our gut health, correct?
100%. Yes.
Yeah.
Yeah.
Okay.
We've linked poor oral health with all kinds of things, all different types of cancers, any kind of inflammatory illness. So, whether that's autoimmune conditions like rheumatoid arthritis, Crohn's disease, I've been able to predict a little mini flare up of my Crohn's by testing my saliva, believe it or not.
Wow. Okay. Oh, I believe it. Yeah.
So all of these things, diabetes is a huge one. If you can't control your blood sugar, you're not going to be able to control your periodontal disease and vice versa. So if you've got diabetes, we absolutely have to have you in the dental office. I say every 3 months at a minimum. Like we talked about, fertility, pregnancy complications, Alzheimer's, dementia, and then even in perimenopause and menopause, we'll see huge changes with
Yeah.
dips in our hormone levels. So
Absolutely.
estrogen falls, progesterone falls, and we start to see the microbiome shift as our saliva shifts. Yeah, everything starts to dry out just a little more than we
Yeah.
would like for
Yeah.
them to, and everything changes. Just like our nether regions get a little
Yeah.
drier, our
Yeah.
mouth does
Everything
too.
dries out. Everything does. And I think a
Okay.
lot of women in perimenopause and menopause complain of dry mouth, but also, I've had some clients where their first sign of perimenopause is literally their teeth are either
Yes.
moving, falling out, new
Yes.
new tooth decay, and they're like, "What is happening?" And
Yes.
again, not realizing that was the start of their perimenopause, but
Hmm.
all of a sudden their oral health just completely spirals downhill, and not realizing. And I guess because all of the tooth decay and things that are happening, the decrease in estrogen, but also the dry mouth contributing to all of that, not
Yes.
being able to, yeah, have the right bacteria, produce as much saliva as you normally can, and probably even affects how you digest your food because you're not producing, you know, enough saliva.
Absolutely.
So yeah, we are just really getting beat down every way we can. It's
Right.
ridiculous. Okay, so what about toothpaste? Is there a certain brand of toothpaste that you recommend, or a couple brands you recommend, or ones to avoid? Talk to us about toothpaste.
This is super exciting that there are more and more fluoride free toothpaste that actually
Yeah,
do a good job. I would say 5 years ago, even that was not necessarily the case. You really had to look for stuff a little bit more. So, right now, there are things over the counter, even at Target.
yeah,
One of the brands that I sell in my office is Boca, and I saw it in Target just a couple of weeks ago.
great. Okay,
So another one is Risewell. I really like that one.
okay,
So there are quite a few really good brands. I say start where you can. Like if
yeah,
you find something at Target or the health food store where the ingredients are just cleaner, then start there. If you can take it up a notch and find something with some xylitol as the sweetener, some calcium hydroxyapatite that can really help remineralize, then to me, that can do just as good of a job as your traditional Crest or Colgate without having to deal with all the weird ingredients that are in those.
okay. So really, but the key is fluoride free.
I believe so. Yeah, I
Yeah,
really do.
yeah.
And
Because
you
again,
don't
we're
need
using
it. Like it's
right.
not it's fluoride is not a nutrient. So don't let your dentist guilt you into using fluoride. There are
Yeah.
all
So
kinds.
no, I was going to say I love that you brought that point up because I want to ask you about that. I mean, we talked about fluoride, but I do feel like when you go and you're like, yeah, we don't want the fluoride treatment, they're like, really? And you're like, yeah, I think we're good. And they're like, oh, are you sure? And we're like, yeah, so I do feel like you're guilted a little bit into, but it's not necessary, right?
It's really not. It's
Yeah.
really not necessary.
Yeah. Okay. So if we're not getting the fluoride treatment then at our dentist's office,
Mhm.
how can we as individuals and even for our families, how can we help prevent cavities sort of through or tooth decay in general? Tooth, as we get older, it's not just cavities, I feel like.
Mhm.
How can we prevent cavities and tooth decay through our diet and lifestyle and, oral systemic support? How
Yes.
can we help ourselves without the use of fluoride?
The first thing is diet, diet, diet. If you can remove some of that low hanging fruit, so if you can remove some of those sources of simple carbohydrates, the processed foods,
Yeah.
we know the obvious stuff, the cakes, the candies, the desserts. Obviously, those aren't great, but it's more than that. It's crackers and chips and granola bars and those kinds of things are broken down into sugar in your mouth faster sometimes than even the desserts are. So
Yeah.
we've got to be mindful of just that low hanging fruit. If we can get rid of the processed foods, I think that will go a really, really long way. And then after that, we've got to make sure that we are adding super nutrient dense foods. And I think most of us, especially if we have if we live in America and have been victim to a standard American diet, I think
Yeah.
making sure that we have enough healthy proteins and fats because most of the vitamins that are critical for tooth health are the fat soluble vitamins.
Yeah.
So get your avocados, get your olive oil, get your, we've got a lot of people who will supplement with cod liver oil, which I think is also great. So tons and tons of healthy fats. And then if you do that, if you get a ton of protein and healthy fats, you're really not going to have a ton of space for all the simple carbs and the junkier foods anyway.
Yeah.
So I would say that's most important.
I love that. I think that's such great advice. I mean, the healthy fats, are really making a comeback after the 90s and our low fat diet.
Right.
Our, every single thing that we ate, we were
Yeah.
trying to eat low fat, and more, trying to debunk that. Helping people understand that really at the cellular level, we have to be eating healthy fats for our brain, for our cells, for just metabolic function overall. And I love that you brought up crackers, because I think a lot of people, myself included, forever didn't realize that, just because you're not eating a cookie or a cupcake or a piece of cake, the crackers and the chips and granola, the quote unquote healthy granola bars that,
I know.
are labeled as such, have the tendency to convert to sugar right in your mouth. And not only are they not healthy for your oral health, but it's, really starts to destroy your gut microbiome in general, but really trying to limit the amount of those. And I think those
So innocent looking. Yes.
they're so innocent looking. Listen, I mean, honestly, all of the labels, I'm really trying to not eat more than 25 grams of, added sugars daily, and that's an 80-20 rule, meaning, I try to follow that 80% of the time. Well, I was at my son, I was, on the go at my son's lacrosse tournament, and I picked up an iced tea that was said just tea. And it was like green tea with honey. So I was like, oh, that's healthy. Right. I know, I see your face. Well,
I already know it's coming.
yeah, start drinking it. And I'm like, oh my gosh, this is great. I look at the label. The whole bottle had 20 grams of added sugar. And I was like, oh my God, I was so pissed because I fell for it. I got duped.
Right.
And even now, I try to be good, and still I got duped from the label. And I think we all just need to be so cognizant of reading the labels, because there are so many foods that are packaged as healthy these days that just aren't. They're just not.
Yeah. It stinks.
It does. It really does stink. I was so mad. I'm like,
I'm a Texas girl. I really love my iced tea. So
yeah.
I feel the pain.
Exactly. And who doesn't love a sweet tea?
Yes.
And here I'm thinking like, oh, it's honey and stuff, but I don't know.
Right.
Still had too much sugar in it. And there we go. So, oh my gosh. All right. Well, tell my listeners where they can find you and learn more about Flourish Dental.
Well, we are in Dallas, Texas, just outside of Dallas. You can find us online at www.flourish.dental. I have a ton of content online. And so absolutely, if you can't fly down, learn from me, get the free info that's on the website and on Instagram, get the freebie stuff. And if you want to come and visit, then we'll help you arrange your travel. Because we do, if people have big stuff going on, then we'll plan, just plan a trip, come down, get your dental work done, and then we'll send you back better than we found you.
I love that. And Dallas is an amazing city to visit. So you know what? Why not?
Why not? That's right.
Yeah. I love that. Well, thank you so much for all of this great information that you shared with us today. And we'll be sure to link all of your socials and your website in our show notes so you guys can find Dr. Toni really easily. And I know I really learned so much from you today. I'm so glad that we got to dive deeper into oral health, because it is so important to our overall health and our gut health. And again, this is a topic that I find so interesting and I love talking about. So thank you for giving us really some of the truth bombs today about our oral health. Like it or not, we all need to stop using fluoride and fluoride toothpaste. So guys, you can find me at Suburban Warrior on Instagram, TikTok, and YouTube. And like I said in the beginning, be sure to go to suburbanwarriorpodcast.com, download your free menopause roadmap from pause to power, and sign up for our weekly newsletter. And don't forget to drop a comment and let us know what you think of this episode, because we love to hear from you and we love to know what you think. And it also helps other women find this podcast so they can hear all this great information that Dr. Toni had to share with us today. So thanks again for listening this week, and we'll be back next week with another episode for you. See you next time.
Thank you, Chrissy.